Hello everyone, welcome to Thoughts and Education program by College Dunia. Today we have with us Dr. Hardik Parab from Akar College of Physiotherapy. I welcome you sir to our program.
Thank you, sir.
So sir has vast experience in the field of education. Sir has been associated with the Akar College of Physiotherapy for more than 7 years. So sir, moving to our first question. Sir, what inspired you to pursue a career in higher education and what drew you to your current role as a principal?
My inspiration to pursue the career in higher education was I still remember that since childhood I wanted to be a doctor. I had seen I used to get fascinated after visiting my family doctor, and my mother was also working as a nurse, so she was also one of the great inspiration for me to achieve career in healthcare. I never wanted to be engineer or any other field. I always wanted to be doctor, and luckily I got admission in physiotherapy. That helped me a lot because this was totally different kind of experience I had. In physiotherapy, you spend a lot time with the patient, so that helps you to build a good rapport with them. So compared to other field, I feel that physios are more in touch with the patient, and they work in the terms of miracles to the patient. So yes, that is a one important thing for me in this career. And being as a principal, I had it was quite a journey that you will get lots of challenges because as a principal you also have to teach, you also have to treat the patient and the administration work. So every kind of work you will get, but the final thing will be the hard work. You have to keep on doing the hard work, and that will help you to achieve your goals and achieve your dreams in your life.
So moving to our next question, sir. What do you see are the biggest challenges facing higher education today, and how do you think your college is addressing those challenges?
Like if I see as an academician, presently the main thing with the present generation or the way the education is going on is regarding the skill. People are not facing or people are not focusing on the skill development. Okay, everyone wants to just pass it out, pass their study, but they don't want to focus on their skill. So that is the first thing, because when I see the students who are coming out as a physiotherapist, but they are lacking the skill, basic skill which required to be a good physiotherapist, they are lacking with that. So as an academician or as a principal in this our college, Akar College of Physiotherapy, and along with my faculty, we all focus on developing the skill in the students, because physiotherapy is a skill-based program. You need to have a good skill, then only you can treat a patient. So that is our main aim, that is our main focus, that we try to develop that skill, whether it will be in the practical class, whether it will be in the theoretical class, or even in our OPD or clinical teaching time. We try to develop that, or we try to deliver the basic skills where a person can be a good physio. So that is our main aim, or as a physio, as a principal, that is our main aim, to develop skill among the students.
Yes, totally agree with your point, sir. So, sir, my next question is, being the principal of Akar College of Physiotherapy, how would you describe your leadership style?
Okay, answering this question, I still remember the day when I got this post as a principal, and one of my senior, he had advised me that, Hardik, be a leader. Do not never be boss. That was a very simple stance, but at the same time it has a deep impact. So by keeping this thing in my mind, I always try to learn with others, I always try to teach others, and when you work with them, when you also work with them, that helps you to be a good leader. So it should not be like you only have to give the orders, you also have to work with them. And as a physiotherapist, when we are dealing in a clinic, there also you are working not only as a physiotherapist, you are working as a leader also, because you are leading a patient. So from that time when I became the physiotherapist, I got this quality to work with people, to learn with them, to teach them, and that helped me to acquire my leadership skill. And the other thing which I would like to tell you, that I have a reading habit. So there are many books which help me to develop this quality, but the main book which I still consider a best book to be a good leader is Bhagavad Gita, which always guides me each and every verses of it, it always guides me to to become a good leader. So yes, in that way, my field is teaching me how to be a good leader.
Such a great advice for the students, sir. So, sir, moving to our next question. How does the curriculum of Akar College of Physiotherapy ensure the best practice of the industry?
As we know that Akar College of Physiotherapy is affiliated with the Gujarat University. So generally, if I want to say, we follow the curriculum of Gujarat University. We follow the guidelines given by Gujarat University, and according to that guidelines and all, we teach our student in mainly three categories. It will be classroom based learning, practical learning, and clinical learning. In first year, you will get classroom based learning and practical learning. Classroom based will be teaching you theoretical part, and practical will be in the laboratory you will get the practical learning. But as a physio, the main thing comes with your second year, that you have to start seeing the patient, and that starts with in your OPD, in your outpatient department, or in the inpatient department in hospitals. So that is a main thing, a clinical based learning. So that is one thing. We keep these three things in focus: that classroom based learning, practical based learning, and clinical based learning. Along with that, we try to focus on the curriculum in the base of evidence based and the problem solving based. That is also helping us to deliver the good quality of knowledge to our students. And the one more thing, that to develop that skill mainly in the clinical area, we do have case presentation, then we do have case discussion, where we all, even faculties and students, we all discuss about the patient. We all discuss about what all kind of assessment things are there, what all findings are there, and how we are going to focus on them, how we are going to treat those issues. So that helped us to deliver whatever things are there in our curriculum. By using this all part, by using all these factors, we deliver it to students, and that helps our student to become a good physiotherapist and to develop a good clinical knowledge also.
So, sir, moving to our next question. What do you think sets your college apart, and how do you communicate that unique value proposition to students and other stakeholders?
Okay, answering this question, I would like to say it again, that physiotherapy, if you want to learn, you need to have a good skill. So that is our first main motto, to be a good physiotherapist. That's why you need to have a good skill of a physiotherapist. So whether it will be in the assessment, whether it will be in the treatment part, whether it will be exercise therapy or electrotherapy, which are the subjects of physiotherapy. So we try to focus on the skill. That is our first thing, that we try to give them a good or focused practical knowledge. We try to give them, we try to make our students more attentive in OPD, where we work with the patient. That is our first thing. Second thing, we do have a great OPD where we are getting, every day we are getting around 40 to 50 patients. All those patients are coming from different kind of field, whether we get a neuro patient, ortho patient, pediatric, cardiopulmonary patient, sports patient, fitness clients. So we have very good variety of patient in our OPD, and at the same time we also have a collaboration with the many other hospitals where we send our students for learning, and they also those hospitals are specialty or multi-specialty hospitals. So over there they also learn to expose, like they get a good exposure, that how or what kind of patient they get, how to treat them, how to assess them. So all in that way we have a very good OPD based system that helps us to develop skill in our student.
So, sir, moving to our last question. Any suggestion you would like to give to the current youth and aspiring students?
Okay, regarding current youth, if I'll compare myself with the present generation, nowadays generation gap comes every year. Okay, earlier it was like 5 years or 10 years or 15 years. In that way we used to get a whole bunch of generation. But nowadays, if you see the 1 year students compare with the senior or junior, you will find plenty of changes among them. And what I had seen, that there is a term in Hindi called as jugaad. Okay, present generation, they want to gain everything in an easiest manner, quickest manner. They don't want to make it in the form of practice. They don't want to practice it. And if you want to make something permanent, you need to have a good practice of it. So that is the first and foremost advice I would like to give to the present generation, that practice makes you permanent. There is a famous saying, practice makes one perfect. Yes, it is there, but according to me, practice makes you permanent. That is also one thing. The second thing is, there is no any other option of hard work. You need to do hard work. So in whichever field you are, suppose if you are in physiotherapy, you have to give your best. If you'll give your 100%, you will get 100% in return. So that these two things, you need to study, you need to do practice, and at the same time, it's very important to have a lightness in your life. Present generation, they all are competitive, they all have lots of stress. So try to focus on your mental health, try to focus on your physical health, and that both things, if you have good mental and physical health, definitely it will help you to be a good what in whichever field you are, it will help you to achieve good success. So yes, that's the main advice I would like to give to this present generation.
Okay, that's all from us. I thank you, sir, for giving your valuable time and sharing your experience and knowledge with us. And thank you again, sir.
Thank you. Thanks a lot for listening to me. Thank you.